third level is about providing smaller groups of people or individuals identified with focused, non-specialized supports. This includes individuals who are struggling to cope, but who are not suffering from more severe mental health difficulties. Trained and supervised workers, such as social workers, community workers, and counselors, commonly deliver support on this level. Examples of interventions at this level include structured individual, family, or group activities, such as counseling or support groups, with a clear objective to address the effects of particularly distressing events or situations. Structured support groups for survivors of violence, such as rape or torture. Basic counseling from non-medical and non-clinical personnel, including social workers or general health care workers. The fourth level is about specialized services. This is mental health support provided by professional mental health workers, such as psychiatrists, psychologists, psychiatric nurses, and other specialized medical personnel. The support is for the small percentage of people whose reactions continue over a longer time and who may be unable to carry on with their daily activities despite accessing support in the previous levels. Examples can be depression, anxiety, or psychotic disorders, including post-traumatic stress disorder. A mental health specialist must be involved in the diagnosis, such as post-traumatic stress disorder, and support must be provided in a sustainable way, which is non-stigmatizing. Examples of interventions at this level includes psychological or psychiatric clinical support for individuals diagnosed with mental health issues, such as psychosis, moderate to severe depression, anxiety, or other difficulties which impact daily functioning. People with mental disorders often do not receive the help they need because of isolation, stigma, fear, self-neglect, disability, lack of support structures. These people are vulnerable, both because of their disorders and because the emergency may deprive them of the social supports that had previously sustained them. MHPSS interventions are not only about what is done, but also how it is done. Interventions at all four levels of the pyramid should be carried out in a way that respects the best interest of the child. Be needs-based, safe, inclusive, participatory, culturally appropriate, and respectful of each individual. The pyramid highlights the importance of coordination among organizations providing mental health and psychosocial support. Coordination is essential in order to ensure people have access to different levels of support according to need. Different service providers must work together to ensure that all sections of the pyramid are catered for. Coordination ensures that coverage is equal and there is no duplication of services. Mapping the different service providers is essential to identify where they work and with which groups.